I do think it's important that we have time for questions and answers at this point. So I know that some questions have been put up in the meeting chat, but what I'm going to do just now is I'm going to ask if there's anybody that can put their hand up if they have a question. I can see that straight away we've got one from Councillor Mary Donnelly, if you want to come on and ask your question.
Yeah, thank you very much. I'm really glad I've attended this presentation. It has been absolutely fantastic. And we as councillors, and I know I'm not alone in this, all deal with trauma when people present to us, either fleeing domestic abuse or whatever their trauma. I know I've got historical trauma and how that impacts in the family. So I've got loads of cases of this nature. My question would be, is my council up to speed? Because all the things that have been presented here today, I would love my council to be doing. I want them to be a trauma-informed council because I would like all our housing officers to be trained because sometimes it's not as a councillor that will get the case, it could be a housing officer, and their first point needs to be do no harm. And I totally get that and I totally understand why that is. But unfortunately, I know harm has been done. I have witnessed it. And we need to make sure at all levels within the council, South Lanarkshire included, we need to be getting it right. And we do need to be there at the first call for people if they're coming to officers or if they're coming to us as councillors. So I would like councillors trained in this. I know they wouldn't need to be the expert, but they would need to be trained at the level do no harm and what that means in terms of their approach when supporting someone that comes to them asking for advice or help. That would be my question.
Thanks very much for that, Mary. And it's an important question. And I think if you haven't recognised any of the things in terms of what's been said in the presentations, if you haven't seen that kind of trauma-informed practice or the rolling out of that information or the resilience film, etc., the understanding of ACEs, that's maybe something that you maybe need to speak to as a council group on your council and speak with officers about, because you're absolutely right. We really shouldn't be seeking to do any harm in terms of the way that we, engage with people who are using our services. And also, I can't remember, but I think it was maybe Kevin who said that sometimes it's traumatizing for us as elected members, officers, people working in the third sector, women's aid workers, when we're hearing the stories, we have to understand how we actually look after ourselves so that we can best help other people. So my plea to you would be to go and speak to officers to find out what is their trauma-informed approach within South Lanarkshire. And you've got Shamila Ahmed on the call today. There's all sorts of people out there who actually can help councils to develop and RSLs, etc., to develop this practice. So I think that's where I would direct you at the moment. I don't know if anybody else wants to chip in on that before I go to any other questions. No. Is that okay, Mary, if we, I can maybe talk to you offline?
I've actually, while I was asking my question, I emailed right over to Housing, the chair of Housing, to say, where are we with this and how do we get this fixed? Thank you for that, Helene.
Great, and you can let me know. Thank you.
I will.
Shamila, do you want to say something there, Shamila, about that?
Mary, I was just going to say that it's great to hear a councillor speaking like you are, and it's about getting other councillors understanding this as well outside of your own area too. We need as many people in leadership positions to know about the prevalence and the impact of trauma in Scotland and what they can do to help us on our journey. And half of the time, in my experience, it's about getting that buy-in. Once you get the buy-in, then things will really start to move, and that's about sharing this information with everybody in your organisation, not just certain sections or silos of it. You know, this is everybody's business, as someone else beautifully said, and getting them on board. And I'm also speaking to Parliament as well about how we disseminate more of this information to elected members. So happy to chat with you further after this.
Yeah, I was sorry, can I come back?
Yeah, just briefly if you can, Mary.
Just briefly. I was going to see if we could get you invited at some point. Yeah, your knowledge is superb. Okay.
Great stuff. That's what this is all about today. I've got quite a few questions now. So I think the order that I saw them in was Bill Brown, and then Annette Ireland, and then Alison Black, and then I'll bring Ruth Robin in as well. So if I can hand over to you, Bill, with your question.
Just remember to switch the microphone on first. Right. First of all, today has literally been a walk through history. I actually worked in housing for about 30 years, and everything that you've been saying are things that I have been tried to push when I was actually working as a housing officer, senior housing officer, etc. But can I ask Andrew, if you can get the word to me, they're doing certain works in sanctuary housing, which we have in various places in Renfrewshire. How is he working with the local authority, and are they trying to work together to spread it out? Because what we don't want is somebody on one side of the street getting a service and somebody on the other side of the street getting nothing.
Okay, very interesting question there, Bill. And I think that anybody that's worked in housing for a long time has been trying to sort these things out, and that's the reason I became an elected member. I'm going to hand over to Anthony. If you can maybe come back on that, that would be helpful. Thanks.
Yeah, so thanks very much for the question, Bill. The short answer is no, we're not started out in the community yet in Renfrewshire, but the plan is absolutely to do that and to engage with as many partners as possible. You know, one of the big things that we're taking away from this is that we're a housing association, and like I said, we've got bags of potential. We also need to know our limitations. You know, we have to make sure that we do everything that we can as well as we possibly can without overreaching and trying to do too much, because then everything becomes a bit diluted. So at this point in time, we're initially looking at policies and procedures so that it allows staff to the space and the kind of the governance really to put what they've learned in the sessions into practice, because in times of crisis, in times of difficulty, people fall back on policies and procedures. So we need to get that kind of stuff in order first. That's the way that we are tackling it. So we'll be getting guidance from Shamila and RLP throughout. But we absolutely will be going out and speaking, like Shamila said, to tenants, to residents, to communities, and obviously partners will be a big part of that.
Fine, thank you.
Thank you. And I think that Shamila's toolkit, I think things like that are going to be key for organisations to actually have a look, you know, forensically at how they are doing and how they actually have to move themselves forward, and, you know, who they can get help from to do that. So I think that today is all about trying to get the word out and trying to export the best practice that we're doing. So thanks very much for that question, Bill. I'm going to come to Annette, if you want to come in with your question, please.
Thank you very much. Huge thank you to actually everyone that's spoken today. I've been busy scribbling away like crazy, but I'll look forward to any information and links that are getting sent out. I wanted to say I'm a councillor over in East Renfrewshire Council, and I agree with what Mary was saying there. I'd like to see some training or information session for elected members here as well. But I had a question for, it was Kevin at South Ayrshire. You said, Kevin, that you did some work with qualities policy that you were looking at updating. Was that right? I would be really interested in finding out how you had built in looking at trauma and a trauma-based approach into that.
Yeah, so that's on the list of things to do. What we're looking to do is an integrated shared assessment that will take in equalities, take in trauma. We're trying to integrate health and all policies as part of that as well. But we're trying to do it in such a way that it's not massively burdensome on managers when they're producing new things, but it's a much more intuitive process where an online system will take you through what you need to do rather than speeds and speeds of form. So we think there's real value in being able to do that, because a lot of probably the traumatisation and re-traumatisation that we do as local authorities is obviously accidental. It's just been built into processes without really that humanity, as I talked about before, being part of that the thinking. So I think if we can make sure that we're assessing that at the start of new strategic approaches and new policies, and I think that'd be really valuable. But as far as we are, we're quite early on in that journey. That's something we'd like to do, but we're not quite there yet.
I thought it was really interesting because I've just signed up for a meeting to discuss exactly this in our new equalities policy. So I might be dropping you an email, but thank you very much.
That's no problem at all.
Thanks for your question. And again, this is what this is about, making those contacts and speaking to each other outside today. So I've got questions from Alison, Ruth, and then Julia Mars as well. So Alison, please.
Yeah, thanks. It was really just as an observation. I think hopefully I put it in the chat box. I'm a counsellor in Falkirk Council, and over the years when I've been, I have a background in psychiatric nursing, and over the years when I've been dealing with antisocial behaviour cases, visiting people's house and hearing how it's impacting on people's lives, and when you hear some of the situations like hypersensitivity, the hypervigilance, etc., and you talk to people, you actually realise that this isn't just because of the situation they're in just now, it's because of things that have happened to them before, and it's they're revisiting some of the feelings that they've had before, and it's impacting on their ability to deal with something that might be quite minor. So I just think maybe that if we look at trauma in terms of that type of situation, and it's happened quite a few times, I think maybe that would be a good way to go. I think maybe if you had information you could give the person about, or you could have a discussion with them about what's happened to them before, and maybe explain why they're feeling like they are just now, and maybe that would go some way to help the situation before it gets out of hand.
Yeah, Alison, I think that's a very astute observation, and I think that if we do look at the ACEs, assessment, etc., we do see how people do sometimes have a hyper reaction to things. And I think for me, one of the things that Kenny said in terms of the dishes and the sink, etc., those are the things, that the front garden that's a mess and you have like a lot of complaints about it, that could be the smallest thing that's actually somebody's dealing with behind those doors, as the front garden or as the dishes in the sink, etc. So I think that we have to be really aware of people's circumstances and how things are affecting them. I don't know if anybody that spoke today wants to comment on Alison's contribution there, but I think it's a very key thing. Anthony?
Yeah, so I can comment. So part of the we didn't cover it because it was, we only had so much time, and I'm happy to talk to people about everything else that we're doing because there's loads of stuff wrapped up in the approach that we're taking. But one of the things that we've contracted RLP to do is some community-based workshops to explore trauma in the community. The reality is that trauma doesn't just happen to an individual themselves. It permeates out throughout entire neighbourhoods. We've got traumatised communities all across Scotland that people are just dropped into and expected to get on with life. We need a massively different systemic approach to this. And so I think you're right that the conversations need to be had with housing staff, with people in communities, with the links between services, and we're going to try that. We're going to try it with RLP. Initially in 2 neighbourhoods where we've got housing. The plan is to extend it across all of the neighbourhoods where we have housing. And listen, I'm not precious about any of this stuff that we're doing. If people want to know exactly what we've done, I'll tell you. I'm very happy to share everything that we're doing here. And if you want to steal bits of it, be my guest, because it's about changing things, not holding on to it.
Thanks for that, Anthony. And Laura's just let me know as well that the Improvement Service in COSLA are actually working on developing a workshop and info session for councillors and elected members across the country with regards to trauma. And they're doing that with the National Trauma Training Partnership as well. So that type of stuff is going to be available to us as elected members. But I think that, there's all this stuff that's happening round about that I think we should definitely be forging contacts with each other. So we are over time again, but I do have 2 more questions. I've got 3 questions that I want to get to, and it's obviously eaten into our comfort break time. So I'm going to come to Ruth and then Julia, and then I'll take the last one from Lynn, because we'll then have to have the comfort break and then go into our breakout sessions after that. So Ruth, please.
Thanks very much. I was really heartened to hear Kevin share his reflections on how he's been able to embed this in South Ayrshire. And I think that gives us a sort of ground opportunity for us to really gain some ground in other local authority areas. So I was just curious about what your thinking was about how we get that leadership across housing, given that Kevin had reflected that he was one of the first or one of the only housing guys in the room when he did his training. And my second point was just about the comment that Anne Gibson has made earlier on in the chat history. Health Improvement Scotland and Public Health Scotland have been looking at housing and trauma and ACEs for quite some time, and I think there's a real opportunity for us to link up a little bit and think about how we could use quality improvement methodology to support these other areas who are really interested in taking it forward.
Yeah, Ruth, I'm always interested when you offer to be helpful in these situations, because I think that the knowledge that you guys have in Health Improvement Scotland is phenomenal, and it it really will help us to move things along. Kevin, I don't know if you want to come in and say anything about that.
I mean, that was the very first training session I was at, Ruth. So I was the only housing person there, but I know there's been a lot of more housing people been on it since then. One of the slides I just kind of skipped by at the end there was a few kind of questions that I think we have to answer as a housing sector, and I kind of touched on it a wee bit earlier in my presentation when we're talking about the things we measure and why we measure them. A lot of it is still around this bricks and mortar approach to housing, and I just think, well, we know where legislation is pushing us from a homelessness perspective, from a housing perspective. We're having to engage more with people with multiple and complex needs. But it doesn't really seem that the reporting part of that and the way we're regulated is moving with that legislation. For example, you can just, as long as you're providing the bricks and mortar part of the service, then that's considered a good service. So how do we, for me to really embed it within the housing system, I think the regulator has a role to play. I think the Scottish Government have a role to play. I think their promotion of what they're doing and putting this into the the champions group and the steering group is all fantastic. But I think there's more to do to embed it. We're all here because we are engaged in this and we've been asked along, and it means something to us. Nobody's really forced us to do it. And I know that sounds quite cynical, but nobody's really pushing us down this way. And that's why I think it's really important that it's a real means to keep that humanity in the system, because the system itself won't produce humanity. It needs people to do that. And it's too often left to chance, is what I would respond with.
Thanks, Kevin. I think the other thing I would just quickly say, I think there's a role here for us to think about evidencing or evaluating the different approaches that have been taken and the impact they're having, in order for us to change the rhetoric to be more about those personal stories and the impact of these changes versus the tenancy sustainment rate. And I think there's definitely some opportunities, I think, post-COVID for us to think about how we can come together around this subject matter.
Yeah, absolutely. There's so many nodding heads I can see at this point in time. I mean, I know that we're going through a service redesign in terms of things that we want to do in East Ayrshire, and part of that is going to be about the void process. And when we're talking about, timescales and data, I want to make sure that I get these voids presented to people in such a way that they're not going to start their tenancy in that situation where they're maybe going to end up having to leave it. If we get the tenancy right, we actually look at people as individuals to assess what they need, like they're doing in Fife in terms of, the women, what do you need to actually make this tenancy sustainable from the outset? And we do need to have those difficult conversations with the housing regulator. We do need to have those conversations with government as well. And we do need to have conversations around the table, at COSLA in terms of that local government leadership, etc. So I think it's not insurmountable, but we actually have to figure out how do we draw all these policies together and make sure that we're actually evaluating how they're working. Because Ruth, you're absolutely right in that. We need to make sure that we see that we're doing the right thing and we don't continue to do something that we haven't actually evaluated yet. So always happy, Ruth, for you to help us along the way with that. So I've got 2 more questions. I've revised the timings again. Well, I haven't, Laura has. I've got 2 more questions. First from Julia and then from Lynn. Julia, please.
Thank you. This is probably a question for Sandra, and apologies, I missed the first part of this presentation because of connection issues, so apologies if it's been covered and I haven't heard it. I'm interested to ask you about balancing the local support for people who are fleeing domestic abuse with the need to keep them safe And I know that Andrea from South Lanarkshire, one of our housing officers, is on this call, so she can maybe actually give me further information after this call. But I know that I've often taken cases where the lady absolutely wishes to be safe, but for her children's schooling or for having family support close, they're reluctant to move away from the area. So balancing that, and also balancing policies in terms of availability of school transport, or which social worker they will then be dealing with, which housing officer. So all those things that have a knock-on effect of how prepared people are to move further away from the problem, but still maintaining the supports they have in place. How do you balance those things in terms of ensuring the tenancy is not swapping one problem for another?
Yeah. Hi, Julia. Yeah, that's a very interesting question, because that is one of the things that our staff felt quite difficult to deal with, because if a lady who was suffering domestic abuse wanted to stay in the same area, they couldn't quite understand why they would want to stay near the perpetrator. But once we sat with them and we went through training and explained that this woman has her own safety plan in place, she knows the best places to go, her children have safety plans in place, they know which area the perpetrator is likely to come from, so they have everything in place. We work with Safe, Secure and Supported at Home, who would go in and put in door bars, would put in letterboxes, would give them other external safety plans like alarms if they're going out. But it's really the woman's choice. We listen to what the woman wants, and if that's what she wants to do, we will put everything in place to support that woman to stay in that area, so that the children can go to school, so that her support network is still there. And then the staff, the housing management officers, would arrange to go out and ensure that the woman was still feeling safe. I mean, we have had ladies who have wanted to stay, but then further down the road have found out it's just too traumatic for them and they wanted to move. That's not a problem, and that's what we would do, you know. But it's listening to the lady and ensuring that what she wants is what if we can put that in place, then that's what we want to do, because they have their own safety plans in place. They know how to keep themselves and their children safe. And by having the early intervention meetings with social work as well, we found that's really good, because sometimes social work can make women feel that they're not looking after their children. And when we sit down round the table, we say, look, that woman is protecting her children by, you know, keeping them in this environment, because if she was to go, it would be different, you know. And it's just getting a different outlook on what that lady wants, but supporting that woman's needs and what she has decided.
Thanks very much for that, Sandra and Julia. That was a very good question to ask. I'm going to go to Lynn, and that will be our last question at this point, because we'll need to have a quick 5-minute break and then head into our breakout sessions. Lynn?
Hi everyone, thanks so much to all the presenters. It's been really wonderful hearing from all the different contexts. I'm a child psychotherapist and I work within CAMHS. So particularly, Kenny, your presentation was particularly relevant. And I think I had psychotherapy training in Scotland, and one of the bits that we're around in terms of a national sort of drive is that in England, there is a move afoot within CAMHS there's a long-term plan to have the CAMHS service extended from 18 to 25. And because for us within CAMHS, it often feels very, very traumatic to stop seeing young people in treatment because of the 18-year-old cutout. And just sort of picking up on your point, Kenny, about the sort of chronological age and the difference between sort of need in terms of, helping people move into the community, especially, people that have been in care experience. So, yeah, it's just really to say that to a lot of people that I work with, that 18-year-old cutoff feels very, very, unsatisfactory, because we would have people in treatment longer, and that would go towards preventing, possible risk of going into unsafe kind of homeless situations. I don't know if Kenny has any sort of comment about that, but yeah, it feels very very unsatisfactory to have our service cut off at 18. Yeah, but thanks.
Thanks, Lynn. I don't really have time for Kenny to come back unless you can come back in one sentence.
Yeah, totally agree. Artificial, arbitrary age thresholds are totally unhelpful across a whole range of areas, and we need to get back to that whole concept of emerging adulthood and redesign our public services around these rather than these bureaucratic constructs. Thank you.
I appreciate the social work services can, you know, sort of care leaving kind of slightly older, but within health it's something that, but it's interesting that England is beginning to look to an 18 to 25 service within CAMHS. So I'd like us to get on the same page as that, to be honest. But anyway, thanks.
Thank you. And I think that we do have to recognise as well that there'll probably be a divergence in terms of different council areas across Scotland working in different ways when it comes to corporate parenting and how they actually deal with you know, young people leaving the care service, whether they're going down the homeless route or whether their pathway is a different way. And I think that for me that's really important because that's not the way that it should work. Young people should, you know, we should be looking at them, as Kenny said, more as if they're actual children that we care for, and how that actually is reflected in our own homes, in our own families with you know, young people staying at home longer. So that's something that I think we have to look at, both of those things. I think they're very related in terms of CAMHS and care leaving as well.